Today, we're going to discuss car seat safety. Infants and toddlers should be rear-facing in the car seat until age 2. Never place a rear-facing car seat in the front seat of a vehicle that has a front passenger airbag. Harness straps should fit snugly against your child's body. Place the chest clip at armpit level to keep the harness strap secure on the shoulders. For school-age children that have outgrown the manufacturer recommendations for a forward-facing car seat and are shorter than 4 feet 9 inches tall, they can use a child booster seat. Older children can start using an adult seat belt if they are between 9 and 12 years of age or taller than 4 feet 9 inches. A seat belt should fit properly when the shoulder belt lies across the middle of the chest and shoulder, not the neck or throat, and the lap belt is low and snug across the upper thighs and not the belly. All children younger than 13 years old should ride in the back seat. We do not typically recommend used car seats, as you may not know the history of it. Make sure to never use a car seat that has been in a crash, that has been recalled, is past the expiration date, has any cracks in its frame, or is missing parts. Make sure it has labels from the manufacturer and instructions. If properly installed, a car seat should not be able to move more than 1 inch from front to back or side to side. If you need help with the installation of your car seat, please contact the Governor's Highway Safety Office to find a child passenger safety technician near you. Every car seat and car seat manufacturer is different, so if any questions, please contact your pediatrician for advice.